We're pleased to welcome Dr. Gwendolyn Mahon, Dean and Professor at Rutgers School of Health Professions. Good to see you, Doctor.
Delighted to be here, Steve.
Describe the school.
So we have a very exciting school. Our school is one of 8 schools at Rutgers Biomedical Health Sciences, which is really a new entity that used to be UMD&J. We joined with Rutgers, and it's very exciting because we're growing, and schools that were at Rutgers focused on health were able to join us as well. So our school, I think, is probably the most unique of the schools in that we don't offer just one program or curriculum. We actually offer 50 programs, as mind-boggling as that may be, all focused on the health sciences. And so, as the name suggests, we educate health professionals.
That includes?
And so that includes, and I won't go into all of them because it's a lot, but to give you the general,
most significant ones
the most significant ones in rehabilitation, so physical therapy, occupational therapy, nutrition and dietetics, imaging sciences, so the people that do sonography and nuclear medicine. Really the best way to think about it, and it's interesting, we're kind of defined by what we're not than what we are in many ways. And what we are is really a significant portion of the healthcare team. So if you look at the healthcare workforce, we make up about 80% of the workforce.
Is this what people call, quote,
allied health? Absolutely. Allied health professionals, absolutely. And so really we're the members of the healthcare team other than the physician, the dentist, the nurse, and the pharmacist. So that's kind of the best way to think about it. So you think about, as a patient, the different people that you interact with as part of the healthcare team.
It's so interesting. People think of healthcare. Well, let me ask you this.
Yeah.
The ACA.
Yes.
The Affordable Care Act.
Absolutely, yeah.
How is it connected to this conversation?
It's very much connected. So if you think about how healthcare has been and where we are in the United States today, and then the changes that have come with the Affordable Care Act actually have a very big impact on our professions.
How so?
I think play a big role. So we're moving from care that is very much based on fee procedure-based reimbursement and moving towards quality-based reimbursement. And what that means is thinking about the outcomes, so the patient outcomes, rather than the procedures that took place. So I'll give you an example that might maybe explain this a little bit better. So think about someone going in for surgery. The reimbursement has always been, for the surgery itself, for the different care that made procedures that took place.
Fee for service.
Fee for service. In the future, and this is very costly, and we have a problem in the country with the cost of healthcare, but we also have a problem with the quality of healthcare. So the idea with the Affordable Care Act was to change how we reimburse and how we think about reimbursing and care, change the model so that we can reduce costs and improve quality.
But what does that have to do with the allied professionals?
So what that has to do with it, rather than it being fee-based, if it's based on outcomes, you need to make sure that that person, when they come out of that surgery, that they're going to have good outcomes. So how do you do that? You prepare them ahead of time. So not just rehabilitation after, where you might have gone for physical therapy, but you do what's called prehab. So before the person, prehab.
Not the rehab after.
Not the rehab after.
The rehab after, which is important as well. But prehab?
But you're prehab. So you're preparing somebody before they go in for surgery.
How would you prepare for surgery?
You do the exercises that maybe you were going to do before going in. You build up muscle strength. Let's say you're going to have a knee surgery. Build up that muscle strength before you go in, so your recovery is going to be better. Meet with a dietitian. Let's start working on that diet now. Meet with a behavioral counselor. Let's talk about your lifestyle and what you're doing and how we can get you healthy now so that when you come out from the surgery, your outcomes are going to be better. So it's proactive instead of reactive.
And by the way, these allied health professionals we're talking about, everyone outside of medical professional, doctors, nurses, and dentists.
And dentists, right.
Are they less costly?
They are less costly, and that's the other side of it. So what you then do is you have an integrated team of professionals where the overall cost associated with the work of those professionals, as compared to a procedure-based reimbursement of a physician that may, doing the surgery, you have prepared patients at a lower cost for better outcomes. So maybe you don't have readmissions later that are going to be expensive. Maybe the person doesn't have to go back for a second surgery. Maybe they don't have other complications that they may have had. So the overall cost of the care goes down because people are healthier. So really the idea is much more preventive and preemptive, and having a whole integrated care with professionals that are focused on different areas of that patient's lifestyle and health.
Let me ask you this.
Yeah.
Do we have a sense of the profile, the demographics, I don't want to generalize, but the kinds of students you're attracting?
Absolutely. So it's one of the things I really love about our school, and I obviously am very excited about our school overall. So we have students, first of all, in terms of age, ranging from high school to 65. So when we had our convocation last year, we had several people above 60 years old graduating. So what we do at our school is, and if you think about the healthcare team, we're talking about a lot of different individuals. There's entry-level positions where somebody can, have an education for about 2 years and be able to enter right into a profession, and then career ladder and do advanced practice later. So it offers a lot of opportunities in terms of workforce, in terms of jobs. We have 100% job placement. If you think about
back up. I'm sorry for
100%
job placement. I was just about to ask you, what are some of the challenges finding work?
We don't have challenges. So
Why
now, of
is
course,
that?
well, there's a couple of reasons for that. One, think about our population. We are an aging population. It is predicted that by 2030, a fifth of the population is going to be over 65. We have a lot of issues with chronic health conditions. Right. This is a low-cost way of providing care. There's a need for these types of professionals, and there's a shortage. The other, what we do at our school, we admit only to placement. So we always make sure that whatever students we are admitting, the number that we're admitting, we track our outcomes, we track where our students are placed, and we move and change very quickly as healthcare changes and new professions come open, we adapt to that. So, and that's why we have so many professions as well, because we're looking right from the entry level to the advanced practice.
Last question I have for you. I want to make sure we have time for this. Jackie, is this, how much time we have? I'm curious about this. There are some folks who continue to talk about repealing, replacing, messing around with, doing away with something with the ACA. Since we don't know what that would or could be, what concerns do you have about the impact on these allied health professionals? Oh,
absolutely. So I think the ACA, and I think it's a start. There's a way to go. We still have a lot to do, but it really moved things in the right direction. The whole basis of this idea of reimbursement changing from fee-based over allows these health professionals to really play a much bigger role, which in the end means healthier people. Because these are the individuals that are working more on the continuum of care, looking at prevention, looking at diet and lifestyle and exercise, which we all know when it comes down to it, a lot of our health has to do with that.
Real quick, last question. Yeah. The number one thing you want your students to walk away from your school with, beyond the skills and tools, what is it?
So obviously the competency. We want our students to be very competent. There's two things.
Real quick, 30 seconds.
So one of them is how to work as a team, how to be respectful of other members of a team. So we spend a lot of time with our students learning how to work as a team. And the other is compassion. And those two things, I think, are just at the center of what we do.
And also being a good communicator, which you are.
Yes.
And I want to thank you, Dr. Gwendolyn Mahon, Dean and Professor of the Rutgers School of Health Professions, playing a more important role than ever before in our healthcare. Thank you so much, Doctor.
Steve.
Well done.
Thank you. Okay, good.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, Seton Hall University, Suez, Summit Medical Group, Choose New Jersey, Verizon, and by the law firm of Gibbons PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.